dynamic entrepreneur. May I have the privilege of calling Mr. Divyanu Gupta, Director, Sarvodaya Hospital, Greater Noida. May I have a round of applause, please, for this young, budding entrepreneur.
Thank you so much, Dr. Galore, for the beautiful introduction. Good afternoon, everyone, and good afternoon for the very warm welcome for the session of Embedding Safety and Sustainability in Patient Care. Our chief guest very well mentioned that healthcare is not cheap, it is expensive, and safety comes at a cost, and that is why we need to address it. Safety and sustainability can sound like oxymorons. दोनों थोड़े contradictory words हैं क्योंकि safety comes at a cost and it makes it expensive. That is why if we go too far in increasing the safety, it might become unsustainable. We take US as an example for the benchmark of level of healthcare excellence that we want to achieve. And that is why I would like to share an experience that I had with one of my friends. My friend who was staying in Dallas in US met me 2 months back, who was suffering from back pain. So he wanted to get an MRI done over there in US. He gave me a call to ask me that how much does an MRI cost over here in India? I told him somewhere around 15, 20, 30,000 depending upon the MRI, but it is a bit expensive. He said it is not expensive, trust me. I'm like, why? Can I guess the cost of my lower back MRI in US in Dallas? Any guesses? 2 lakh rupees or dollars? Any other guesses? $16,000. That turns out to be somewhere around 12 to 14 lakh rupees over here. So that is why this topic is quite interesting, because the way healthcare is proceeding and the way we are going ahead with technology and development, it is very important to bring that balance where we do not compromise on safety, but yet we keep in mind the population, the people that we are serving, and it should be sustainable for them. Moving ahead, so that is why the landscape of healthcare is evolving faster than ever, and it is expected not just to deliver outcomes, now it is expected that we deliver outcomes with safety, sustainability, and still the human touch. This session brings together 2 leaders who present these ideals in action. They will share how their institutions have redefined excellence through systems that care, empower, and endure. It is my pleasure to introduce Mr. Joy Chakraborty, Chief Operating Officer of PD Hinduja Hospital and Medical Research Center. With over 2 decades of leadership experience, he has played a pivotal role in shaping hospital operations, patient safety, and sustainable growth. Mr. Chakraborty is a postgraduate in healthcare management and serves the CIS Healthcare Initiative Committee and CAHO Governing Council. He was recently recognized by NABH as Patient Safety Champion 2025 for his outstanding contribution to quality and patient-centered systems. Please join me in welcoming Mr. Joy Chakraborty to share his perspective on sustainable excellence. I would also like to call, just a second. It is my privilege to introduce Mr. Gaurav Loria, Group Chief Operations, Safety and Patient Experience at Apollo Hospital Enterprises. Mr. Loria brings over 18 years of experience spanning quality, patient safety, and large-scale healthcare operations. He is a Six Sigma Master Black Belt and Administrative Surveyor for JCI and respected thought leader in digital transformation and patient experience. His career reflects a deep commitment to blending operational precision with compassion and care. Please welcome Mr. Gaurav Loria. Sir, Dr. Chakraborty, I would like you to take a seat.
So good afternoon at the outset. Thanks to Dr. Gupta, Ms. Bobby and the entire team of this hospital, Sarvodaya, and I happen to hear a lot about this hospital, but first time it is my privilege to come and see the hospital. So my topic which has been given is the balancing cost, sustainable excellence and balancing cost, quality and patient satisfaction. It is like, have you seen those balancing acts that you are in a rope and you need to go from one point to the other point and need to ensure that you don't fall. So when you play with these three factors and you try to ensure that you want to achieve, it becomes a really difficult task. So what is the challenge? The challenge is improving the quality and satisfaction of the care journey, and since morning we spoke a lot about healthcare, how complex it is, VUCA world, Dr. Singh has told. Moving beyond individual care, so right now we think and we always used to believe that you just manage one patient, one individual, but it has gone much beyond that, and delivering high value care, and I'll emphasize on this value part of it very soon. Eliminating waste to ensure financial sustainability. And for that you have three, in this triangle if you see the three corners, it needs to ensure quality outcome, it needs to give patient satisfaction, and it needs to be, the cost of care should be such what can be affordable for others. Now Dr. Gyani mentioned about the government hospital, they have a bill and they may not know that really how much they're incurring, whereas the private institution, when they charge a patient some amount, it becomes very high as per their perception. And that is exactly the cost of care where we stand. What we can afford, what we can avail versus what really we want to access. When there is a issue of symmetry, there is an issue of perception, then all this thing goes in one direction, and patients, they come out from the system in a very unhappy manner. If you see the current system, the system is under pressure, and I'm sure all of you like me are thorough that the inflation for the healthcare cost is going up, and that is resulting into so much of dissatisfaction between the insurance company, healthcare providers, and finally the patients who are at the center of our entire journey. Change in payment models. I can tell you 20 years back when the private insurance was covering only 5 to 6% of population, today it has reached 16 to 17%. So there is a huge change in the payment mechanism, and everybody is becoming very, very demanding. As recent as last week, in our hospital, one of the insurance companies started demanding some of the records and clarification from the doctor that why certain things have been used for a particular patient. And I think all of us, we got that kind of query for the first time. So that is changing. The second is quality. And as we know, one of the questions in the previous session was asked, what has changed in this India in last 2 decades in healthcare sector? I can tell you confidently, one thing has changed, that is quality. And probably before that we heard about JCI, JACO and all, but 2003-4 we saw the introduction of NABH, and since then today so many hospitals, so many even small size healthcare providers, they have come under that, and the huge consciousness of quality has emerged, and thanks to Dr. Gyani, the kind of leadership he has shown in this country, and our patients, our community has become very much quality conscious for healthcare especially. And finally the patient satisfaction. I'm not sure how many of you are familiar with this. We calculate something called Net Promoter Score. When I started my career, we are only happy to see who is satisfied, who has a reservation, and who is not satisfied, going and finding out, the kind of dissatisfaction, the reason, the cause they had. But today it has gone much beyond that, and we are calculating net promoter score, where in a scale of up to 10, you see the top two who are all giving us what kind of patients or your customers are in that range, and you minus people who are between 1 to 6, and you calculate where you stand, and it has become a benchmark not only for the healthcare, for other sectors also, and people have started comparing between all the sectors and looking at how it is working, and that is the way things have changed. Earlier, patient satisfaction, customer delight, patient delight, but now we are talking about something, patient experience. The challenge has evolved, and all these are also happening at the cost of physician burned out. So Dr. Gani was talking about 3 beds per 1,000 population, but we also need to see, even if we get 3 beds, who is going to serve in those beds? Whether we have adequate doctors, nurses, we have, all of us, I need not to talk about that emphatically, but I can tell you that is causing a huge stress, and that is causing burnt out, not only for the physicians, but probably even for the nurses and all. And as a result of that, we have a quadruple aim. And what are those aims? We have quality outcomes, what we need to achieve, physician experience. We spoke about experience, but I mentioned so far only about patient experience. But believe me, the Western world has gone few steps forward, and they have started working on employee experience. They are working on physician experience. The reason is simple, that if they don't have a positive experience, you cannot deliver a positive experience for your customers. In our case, it is patient. I'll give you a small example. Today morning, while I was coming since yesterday, when Mr. Ashok Sharma was in touch with me about my logistics from the airport, and then yesterday he was messaging where he told I will come. I said it is far away, why you want to come, just give me the driver number. But he still came. So sometimes I come across this and I go length and breadth of the country and I see that. But while I entered and sat in the car, in 30 seconds he gave me a small pouch. I don't know whether any one of you have experienced. Yeah, those who have come from outside, you have experienced. There is a small pouch. He told, sir, little water and refreshment. I thought that is also okay. But on the top of that, when it came a small slip written Joy Chakraborty, it was a personalized one. That has made a huge difference, and that is what you can create your own experience for your own patient, your own target group. And when you do all this, you need to balance with the cost of care, and how that cost of care comes and how the value comes. We'll talk about that soon. So there are, different ways to create this better experience. We can see investing in physician well-being through AI tools, improved workflows, and crucial strategy to mitigate this loss. So, today we have decision-making tools, AI-based. You have things what help people to take quick decision, getting those. Dr. Again, from Max, there was a presentation where I could see Dr. Arti Varma was talking about X-ray reporting, applying all these technologies to get better outcome. Those are there. And addressing burnt out is therefore a financial imperative as well as a matter of healthcare quality. This investment should be viewed as an expense, should not be seen, because when you do this investment, it can help you to get and garner better outcome. Okay, I will not that. Okay. So, if we really need to, go ahead, and I'll be a little faster now, leveraging technology for this efficiency. So, if you are thinking about bringing down and getting the cost under control, you need to this technology at your end you can use, and I have several examples of this kind of technology usage in our own hospital, whether it is voice to text, whether it is patient remote monitoring, whether it is a doctor's room getting clinical chart done. So many of these things what we have used, and those are giving a huge amount of leverage to us to improve the patient satisfaction. From reactive to predictive, so you need not to wait, and somebody was talking about in the morning that if you give the patient data and if you see they are on a particular antibiotic, you can predict, you can say somebody may have developed ventilator associated pneumonia. So that is the kind of prediction can be done. AI, intelligent automation, so in non-clinical areas we have seen things like RPA, we have seen application of different agentic AI solutions which are adding a lot of value and giving better patient experience. Remote monitoring, personalized care, so today everybody wants to be pampered in their own way and they have individualistic expectations. So how do you get that? And the financial foundations, that how do you get your stakeholders aligned with you the way you have evolved your own financial structure. How do they get, whether they get the fee for service or they get value based care. So here most important shift what we need to see, what is this value based care. And in US one Michael Porter, who is a health strategist, who came up with this, and he started looking at how do you measure value. Value is not that every time a patient comes to your hospital you treat them, they go out. It is basically you need to see for a longer horizon, for a particular sickness, particular disease. When they come multiple times, they each visits, and against that what is the kind of expenses they incur. When you see the cost of that entire period, that can help you to derive this value. Operational excellence and patient centricity, and already so much of discussions have been done. Reduce variation, zero harm, lean principles, and many of these Six Sigma lean projects we have undertaken in our hospital, and which helps us to stick to the basic thing, that do it right the first time. So don't start learning at the cost of your patient and patient's life. Mapping the patient journey, the experience dividend. So as a result of that, in our hospital, and I think in many hospitals they have done, don't think when the patient reaches you, start thinking about when they look for a credible healthcare partner. And since then, even after discharge, when they are not coming to you, how do you keep them engaged with you, and you get them information from you, communicate with them, and you ensure they are part of your entire system. That is the most critical and crucial part. And these are some of the challenges, and I will not take much of this. And we had an excellent presentation on the leadership. I happened to hear him 2 decades back. So I was remembering that talk when he was in 108, and I remember some of these things what he told today, that how correct it is, that it can't be that you read in theory or you sit in a corner or you think it comes with your position. It has to be done in a particular model where your incentive data, and big data is big thing today, and at the same time what we've seen just 3 days, 4 days back, we got the DPDP Act rolled out, and today it is going to be applicable after 18 months. How we are becoming, aligned to the government act what has been introduced. How do you manage this data? Clinician well-being is one of the major. When I say clinician, I also mean other healthcare professionals, nurses, technicians, everyone. I talk about each one of them. How do you bring that cultural change? And as a result of that, the new equation is going to be smart technology, new care models, engaged workforce. When you have all this together, then only you can achieve your sustainable excellence, which is not only financially, but what you can continue to deliver in a longer time. So thank you very much.
So good afternoon everybody. Thank you for having me here today. The timer, and I'll make sure that I finish it within 10 minutes. So So starting with that, I think I got a very interesting topic, future forward. What's the future in terms of service excellence that we are looking at, and how do we embed these safety points as part of patient experience? And why are we talking about it at this stage? What is going to be the hospitals looking like, or what's going to be the expectations in the next decade? You know, clinical is undoubtedly number one. This is why patients come to a hospital, not because a hospital offers great food or a clean washroom. Definitely technology, use of interventions, use of digital systems that help to cure your problems, that definitely stand there. But then safety, which adds to a seamless trust, seamless experience leads to largely trust. And I think trust was definitely also addressed earlier in the earlier sessions. So trust becomes a very, very critical factor which people are looking at in all aspects. It's just not the clinical care, a great doctor, but it's also about trust on the complete hospital and the services. And why are we talking about it now? We're talking about it now because our systems are getting more and more complex. The chances of errors are increasing with that complexity. The number of equipments that we are using are becoming complex. We are definitely increasing the number of touch points for a patient within the system, patient or his family for that matter. There are efficiency issues, there are volume related issues, there are bed shortages, so there are multiple problems. And the gap that we need to largely bridge is that if we don't put in the safety bit of it, or we don't handle the safety bit of it in this, the whole service chain will collapse. Because if you look at it here, safety would definitely impact your process, clinical accuracy, handovers, errors, and ultimately overall patient experience. So that is where it really becomes even more important. So what does the future forward timing mean? What are we talking about it here? Are we talking about hospital without walls? And some of these points were definitely addressed with Joy in the previous presentation, so I'll not get into the details of it. But we are talking about hospital without walls. Is that the future that we are talking about? The EICUs, telemedicine networks, doing consults through using my app, or what is it? Is it shift from prevention to well-being, or shift to largely prevention and well-being? Are we talking about ensuring that we understand what our risk rates are, what our triggers are based on our genetic makeup? Are we trying to look at what is it that we need to work on so that we live long? And you know, the next thing that people are talking about it today is longevity medicine, right? How do you live longer, a healthier life? There are many longevity experts that they're talking about it. So that's something which is very, very critical and very important in terms of future forward. Efficiency and optimization. How do we ensure that we are efficient and optimized in terms of our processes, in terms of our systems? How do we ensure that everything is working the way it is supposed to be working from the organization's perspective and from the patient's perspective as well? So that becomes very critical. And are we utilizing all our resources effectively? You know, you have an operation theatre, doesn't mean that you just utilize it in a way that is a wastage of resource. You have 2 hours delay in operation theatre which is not used because your surgeon was not there, and in the evening you extend by 2 hours by putting an extra pressure on your staffing, on your electricity, water and all the other resources. Right? So optimization is something which is very critical and important. So what we did, we first started looking at largely, you know, what's a patient journey map in terms of an outpatient, in terms of an inpatient. So that we understand the details of it, and this is just a sample of that process. Then what is important is when you redesign this whole map, whether it is outpatient, inpatient, daycare, dialysis, chemotherapy, you kind of first visualize the future flow. And when you visualize that future flow, in those aspects you also build in service excellence or patient experience pointers. You do build in safety aspects into it, which becomes very critical and very important. I'll just give you a quick example. About 2.5 years back, so our MD, she called me and she said that I want minimal touch points for patients. And that's what, when we started looking at it, and we realized that just for an outpatient process, we have almost about 8 touch points for a patient. And a touch point is that when I enter the hospital, I go to someone, then I go to someone else for something, then I go to a billing guy for a billing. If I need to buy a medicine, then I go somewhere else. So how do we reduce these touch points? And we really worked harder on it. Where can we get in technology? Where can we get in awareness improvement? We are still not there completely what we want to achieve, but definitely we have been working on that. And so today from 8 we have come down to 4, and we are seeing if there is a way that we could reduce it more and have everything maybe in your hands as far as touch points are concerned. So if we look at the first touch point, which is largely registration or OPDs in your outpatient when the patient arrives, and this is just a very quick one example of a flow. So the risks or the safety risks that largely could come in here is a wrong data that is mapped of the patient. There could be communication errors, there could be delays, there could be chances that patient information is not captured appropriately and accurately. So what do? You largely make sure that for the delays there is a decongestion, there is patient communication in advance. Think of a future forward system wherein, if I know that the doctor is getting delayed in the surgery, and I know that this patient's appointment is going to get delayed by 1 hour, there is a message which goes to the patient before 1 hour that he leaves his house, that this is getting delayed, your appointment is shifted to this time, do you want to continue, do you want to change it, if yes then press here, and we help you to reschedule it. Or in a way that, okay, now you leave after 1 hour from your home, considering your travel time from your home is 45 minutes to the hospital. And this is all happening at the back end with the use of technology. Imagine a world like that, and that is what future forward is going to be. On the consult and diagnosis, so now we say that doctors are spending less time and they are forced to enter things on the system digitally. They are stressed out. So there are techniques, as Joy also spoke about, speech to text applications that are there. But for that, patients don't have to go and stand in queues. Rather, at the same desk, at the same place, same functions are performed. And that's where we started in our hospitals. One desk, 7 functions. That any desk in outpatient, if you go, they can do billing, they can do registration, they can do consult, they can collect the money, they can book your radiology slots, they can book your operation theatre slots or endoscopy slots. So this is what you need to start looking at it when you look at the whole process of how do we move towards improving on the touch points. And the other things that we are also looking at is wayfinding kind of technology that helps patient to navigate and reduces the dependability on hospital staff or anybody else for that matter. Touch point 4 that I would like to quickly talk about is your inpatient journey, which is admission, treatment, monitoring. So in that, how do you make it simpler and easier for a patient that as soon as a doctor advises on admission, how that whole stream gets done so that patient doesn't have to go to a counter. We are looking for a future where you don't have any admission department. You have bedside admissions, you have admissions that wherein you go to the patient and you talk to the patient, you make them sit. We are working towards it. There is a lot that needs to be done in these spaces. So largely these kind of departments, patients need not know where is your billing department per se, where is your admissions department per se. So these are some of the ways in which probably we should identify these touch points and work on these. Discharge and post-discharge, ensuring that there is a proper planning done. The process is started much earlier. There is an AI-generated discharge summary which the doctor validates based on the information that has been added. And this information is largely then transcribed and then made sure that this is available for patients on discharge. As soon as a discharge summary is done and automated, the whole piece goes to pharmacy, radiology, or for the doctor's secretary for the follow-up consults, and the whole process is streamlined so the patient doesn't have to wait at any point of time. And you can get the patient out of your system within 60 minutes or max 120 minutes. So So there is a lot of work that needs to be done. There is a lot of work that is going on, and I'm sure each hospital is struggling, learning and moving forward in their own ways. But there is a lot of scope that still needs to be looked at, because patients' expectations are increasing day by day, and it is just not that, I go to a hospital, if you ask me to wait for 30 minutes or you ask me to wait for 3 hours to see a doctor, unless I am really very keen to see that doctor, okay fine, I'll go to someone nearby, I'll do it virtually, or let me know if there is anybody else who's available. And that's the mindset that people are moving towards. So we need to be very clear in what we are measuring, what we are monitoring, and how are we continuously improving. Just some of the metrics that we can largely look at, obviously patient outcomes, patient experience scores, NPS, or however we are measuring it, becomes a very important and a critical KPI or a metric. And if we look at patient experience for the future largely, so predictable steps, making sure that we know what's going to happen. So for patient also there is some clarity. They have enhanced and effective and better communication for sure. We are looking at safe handovers, digital safety cues, which we also heard Joy talking about, the real-time alerts that goes to the patient, and something as simple as patient knowing his discharge status. Where is it stuck? Nobody is aware. Everybody gives a different information. Why can't you give that like an Uber app on his phone so that he knows where his discharge is stuck? Similarly, insurance status. Where is insurance stuck? Why is he not still got the approval for that? And a lot of the other alerts, which are life-saving alerts, and many other alerts which are being used these days, smart checklists, and obviously high reliability staff that focuses on zero harm or zero errors. That's what we took as part of our quality journey about 1.5 years back, that we need to start moving towards zero harm, high reliability hospitals. It's tough, it's difficult, it's easy to say, and it's very easy to say I have zero medication errors in my hospital. It's very easy to say I have zero deaths in my hospital because of patient harm. But when you start measuring it, when you start monitoring it, every hospital has problems. It's just that we need to identify, we need to be open to those and start working with our teams to make sure that such incidents don't ever happen again. So how do we learn, how do we share, how do we benchmark, and how do we use this data is something which is very critical. So that's what from me. Thank you so much for patient listening, and as I promised, I'll finish it within time. Thank you.
Thank you so much, Mr. Chakraborty and Mr. Loria, for sharing insightful information with your experience and re-emphasizing on the fact that balance is the key when we talk about safety and sustainability. We have to make sure that everything, without compromising on any of these important factors, how we maintain that balance and make sure that the healthcare stays sustainable with safety. Thank you so much. And
thank you so much the speakers and the chair. And may I request Mr. Divyanu to felicitate our speakers. May I request Mr. Divyanu to please come on the red line and felicitate Mr. Joy Chakraborty, who's Chief Operating Officer, PT Hinduja Hospital and Medical Research Center, Mumbai. Can I have a round of applause, please? So we can have a bigger round of applause because lunch is very near, just a few minutes away. Thank you, sir. And may I now request Mr. Divyanu to felicitate Mr. Gaurav Loria, who is Group Chief Operations, Experience and Safety Office, Safety, Apollo Hospital. Now may I request Mr. Venkata Changawali to please come on stage and felicitate our chair, Mr. Divyanu Gupta. Round of applause for the youngest person in the auditorium. And may I request both the speakers to please join for a group pic. Request, sir. So last few moments before we are heading for a lunch. So for the lunch on the same floor, I would request our delegates to please go on the same floor.